Sorry for interruption, there was a call. Okay. This is, however, but rarely the case, and beside it, this is that a medicine is slowly, progressively in a single dose and cure the case. This is very rarely happen. Even slowly, even if it is occurring slowly, it is your duty to hasten up the cure. To hasten up the cure. This is often a university question in your examination of third BHMS and final BHMS examination. That is, what is to be done in order to hasten the cure? What is to be done in order to hasten the cure? Your answer will be these 3 points mentioned in aphorism number 246, 5th edition. Okay. This period, and this may be very happily affected, as recent and often repeated observation have taught me under the following conditions. Firstly, if the medicine selected the utmost care was perfectly homeopathic. Secondly, highly potentized, dissolved in water and given in proper small dose. Okay, highly potentized, dissolved in water. That dissolved in water has not been mentioned in 5th edition there. Okay, that has been there. Go to 5th edition, 46, minutest dose. Okay, second condition was if it was given in minutest dose. That is the only condition mentioned here. But here is the secondly, highly potentized, dissolved in water and given in small dose. Okay, that experience is thought as the most suitable in definite intervals. Underline this, definite intervals. The third point have been not been there, but this definite interval, that means repetition should be at different interval. Third point in the 246, 5th edition was repetition should be proper at suitable interval. Okay, third point, if in university you have been asked what are the measures you will take to hasten up the cure, these are the 3 measures you have to take to hasten up the cure. Okay, according to 5th edition you have to write. And in 246 same thing has been said, but with a slight different tinge. Okay, for the quickest accomplishment of cure, but with the precaution that the degree of every dose deviates somewhat from the preceding and following. Underline this. In LM potency, every time you administer a new dose, you ask your patient to suckus this file of LM potency 10 times. And what this will do? This will increase the degree of potency slightly. Okay, even in urgent cases, we ask our patient to keep ready the solution. How to make LM potency solution from the part of physician. From the part of physician, how to dispense 100 ml bottle in 100 ml. Forgot that 8 tablespoon or what. Okay, that is for academic purpose only. All the practical purpose, this has been standardized to 100 ml 100 ml with a single poppy sized granules of globule of LM potency. Put that globule in it and forgot that charcoal. Okay, 2 methods academically you should know that there is 2 methods to preserve this water from getting fungal in from reducing, means checking the growth of fungus in this water. 2 methods are there. One is to give few drops of RS, okay, rectified spirit, and other is to put a charcoal in it. Okay, and whenever you want to suckus, this piece of charcoal should be withdrawn and then suckus. So that is, the charcoal is keeping the fungus away. So that is the outdated method, no one use. And if you give the charcoal immerse in your bottle, that also the patient will not use and will not return to you. Okay, so better to use rectified spirit. So 100 ml of water, few drop of rectified spirit, and 1 single globule of what kind of water you are using? You are going to use distilled water, that reverse osmosis. Okay, the RO water we are using, that used also, that has been being used in NIH also. Okay, there is a RO plant from where the water is being prepared. Okay, so distilled water, LM potency single. Okay, give me a minute. Okay, so and now you ask your patient to take half cup of water, around 50 ml of water, succus this LM potency 10 times, this bottle 10 times, and ask 5 ml around 5 ml of this around in 50 ml of water, and stir it and take a teaspoonful from that. That is a single dose of LM potency. In urgent cases, you ask your patient to ready made the solution, and from there he will take every 10 minutes or every 15 minutes after stirring it well. Okay, that will also increase the potency to somewhat. Okay, if you are asking a patient to ready made a solution of medicine and from there take every 5 minutes or every 10 minutes, don't forget to ask your patient to stir it well. Okay, now perfectly degree of every dose deviates somewhat from the preceding and the following. Underline this. In order that vital force which is to be altered to a similar medicinal disease be not arose to untoward reaction involved, as is always the case with unmodified and especially rapidly repeated doses. Underline this: unmodified and rapidly repeated doses. Okay, now there is a footnote here. What I said in the 5th edition of Organon in a long note to this para, in order to prevent these undesirable reaction of the vital energy, was all that experience I had justified. Okay, but during the last 4 or 5 years, however, all these difficulties have been wholly solved by new, altered but perfected method. Underline this: new, altered but perfected method. The same carefully selected medicine may now be given daily for months if necessary. Underline this: daily for months if necessary. In this way, namely after the lower degree of potency has been used for 1 or 2 weeks in treatment of chronic diseases, advance is made in same way to the higher degrees, beginning according to the new dynamization method taught here with the use of lowest degrees. Okay, so months together. This point, some those who are not acquainted with the LM potency, they will actually oppose and take this line if necessary. Okay, and forgot that in the aphorism himself is saying this is rarely a case. Okay, so that is not the rule, that if necessary is not the rule. It is if necessary is the rule. It is not the exception here. Exception is the rare cases where the single dose have been useful in curing the case. Okay, so that is where the LM potency can be given in a single dose. Okay, that is the rule. Rule is if necessary. Okay, and always it is necessary. Always you will see, because that cases are rare. Getting me? Like those who are not actually practicing, okay, not seeing patients, not using LM potencies, deemed to comment like this that LM potency should be given in single dose. Okay, that is rare cases. In rare cases, and they malign NIH and tell that this is NIH method have been developed by teachers in NIH and popularized whole over India and over in the whole world. Okay, that prepare a bottle, give it to patient, and the patient will take 16 doses daily once or twice. Okay, I have seen teachers giving 2 bottles, 0 by 1, 0 by 2. After one is completed, other will be started. Okay, that is for months together, single dose. Some teachers were giving every alternate day, some were giving twice a day. Okay, depending upon the case, but that is where the LM potency is required in single dose is of rare occasion. Okay, not the rule. Rule is everywhere you are needing repetition either to hasten up the recovery or to just to hasten up the cure. The slowly progressive amelioration is there, you have to repeat. If the progressive amelioration is slow, what you have to do? You have to repeat. Okay, and sometimes there is no amelioration, and you have to repeat. Okay, but if you are getting a patient who is responding to the very first dose and quite well, that is exceptions. Okay, and always remember, exceptions don't make a rule. Okay, exceptions are exceptions. Even there is exception, there is exception to a law of gravity. Okay, there are exceptions to law of motion, there are no exception to lots of things. So that is not nullifying the law of gravity. Okay, that is not and rule. Okay, there was a call and this was interrupted. Okay, so where were we? So exception is that single dose in an exception in LM potency, not the rule. That is our point of view for all the practical purpose in our clinic. Okay, for viva table, for examination, if the examiner is not acquainted with LM potency, they will trouble with you with this answer. So diplomatically you have to come out of this. Okay, especially those who are from NIH and doing MDs, they will be in trouble with those kind of examiners. Now 247, it is impractical it is impractical to repeat the same, it is 6th edition, okay, 6th edition. It is impractical to repeat same unchanged dose of remedy once, not to mention its frequent repetition and short interval in order to delay the cure. The vital principle doesn't accept such unchanged doses without resistance, that is without other symptoms of the medicine to manifest themselves than those similar to disease to be cured, because the former dose has already accomplished the expected change in the vital force, vital principle, and a second dynamically wholly similar unchanged dose of the same medicine no longer finds therefore the same condition of the vital force. The patient may indeed be made sick in another way by receiving other such unchanged dose, even sicker than he was, for now only those symptoms of the given remedy remain active which were not homeopathic to the original disease. Hence no step towards cure can follow, only a true aggravation of the condition of the patient. But if the succeeding dose is changed slightly every time, namely potentized somewhat higher, underline this, then the vital principle may be altered without difficulty by the same medicine, the sensation of natural disease diminishing, and thus cure might be nearer. Maybe nearer, underline potentized somewhat higher. Okay, that is what we are asking our patient to give 10 stroke to the medicine. If he is not giving 10 stroke, or if he is getting this medicine directly, okay, that will cause an aggravation and the medicinal symptoms will be coming. Okay, now go to footnote to this, footnote to 247, 6th edition. We ought not, even with the best chosen homeopathic medicine, for instance, one pellet of the same medicine that was beneficial at first, to let patient have a second or third dose taken dry. In the same way, if the medicine was dissolved in water and the first dose proved beneficial, again I'm reading, we ought not, even with the best chosen homeopathic medicine, for instance, one pellet of the same medicine, same potency that was beneficial at first, to let the patient have a second or third dose taken dry. Okay, that is not allowed. In the same way, if the medicine was dissolved in water and the first dose proved beneficial, second or third, even smaller dose from the bottle standing undisturbed, underline this, even in interval of few days, would prove no longer beneficial, even though the original preparation has been potentized with 10 succussion, or as I suggested later with 2 succussion, in order to obviate this disadvantage, this according to above reason, but through modification of every dose in its dynamization degree, as here we teach. There exists no offense even if dose be repeated more frequently, even if the medicine be ever so highly potentized, with ever so many succussion. In it almost seems as if the best selected homeopathic remedy could best extract the morbid disorder from the vital force, and in chronic diseases distinguish the same only if applied in several different forms. Okay, the bottle is kept undisturbed and patient is again taking from here. This will be also the same dose, but if you are giving 10 succussion, and then taking it, that is somewhat modified. Okay, nothing to discuss here. Just underline that the bottle is kept undisturbed, standing undisturbed. Okay. Now come to 248. For this purpose, we potentize the new medicinal solution with perhaps 8, 10, and 12 succussion. Okay. This new medicinal solution, how it is prepared, that has been given here in the footnote. Okay, that we have discussed before. Okay, that we have discussed before how it is this medicinal solution have been made. Now the second part of this footnote is telling us about the cup. Okay, the cup method, how to increase the cup. Okay, we will read it. The first part is how to make. Made in 40, 30, 20, 15 or 18 tablespoons of water with addition of some alcohol or a piece of charcoal in order to preserve it. Okay, that has been discussed. If forget 40-30 tablespoonful, remember 100 ml. If charcoal is used, it is suspended by means of a thread in a vial and is taken out the vial when the vial is sucked. The solution of the medicinal globule, and it is rarely necessary to use more than one globule, okay, of a thoroughly potentized medicine in a large, and that is the LM potency globule, the 10 number size 10 poppy seeds globule. Okay, large quantity of water can be observed by making a solution in only medicine in large quantity of water can be obviate by making of solution in only 7 to 8 small tablespoon of water, and after thorough succussion of the vial, take from it 1 tablespoonful, put in a glass of water containing 7 to 8 spoonful, stir thoroughly, and then give a dose to patient. Okay, up to this the first method, the method have been discussed up to this. Okay, what you are doing, actually you are taking a bottle of LM potency, preparing a medicinal solution for your patient. Okay, this you have given to your patient. Okay, now patient will succus this 10 times, and we have standardized half cup of water. Okay, from here patient will take 1 teaspoonful. Okay, one tablespoon that you have given to your patient. Okay, this bottle you have given to your patient, this bottle you have given to your patient. Okay, standardize it. Here in the footnote this has been told that every time you have to make this bottle and all, forgot that, but the practical part I am discussing. This bottle you have made with LM potency and given to your patient. Ask your patient to take from here 1 tablespoonful, 1 teaspoonful, that is around 5 ml, to the half cup of water, and from here the patient will take 1 teaspoonful, that is 5 ml. Okay, this is that dispensing and finally taking the medicine. Okay, now next part is, if the next sentence, if he is unusually excited and sensitive, underline this, that the first dose has created an aggravation. A teaspoonful of this solution, okay, may be put in a second glass of water, that is this. Instead of taking from here, it should be mixed here, and from here the patient will take. Okay, the second glass of water, thoroughly stir and teaspoon of dose or more be given. There are patients, now this was first cup, this is second cup, and there are patients who need third cup, maybe needing fourth cup. Okay, I have seen patients under my teachers who are taking medicines in 50th cup, 25th cup, 12th cup. Okay, then the patient का भी ऐसा जिगरा चाहिए और doctor का भी ऐसा चाहिए. So don't practice this in your initial days of practice. Okay, patient will give a stamp on you of being mantro tantro and leave you. Okay, the patient will think the doctor is doing some mantro tantro and will leave you. Okay, so don't use this technique in your initial clinic. What you have to do if the patient is getting aggravated, I will tell you. Okay, fourth cup similarly prepared may be necessary. Each such prepared glass must be made fresh daily. The globule of the highly potentized is best crushed in a few grains of sugar of milk, which then patient can put in the vial and be dissolved in the requisite quantity of water. Okay, so that if we are not doing, we are directly dispensing the things and giving it to and giving to the patient. So it is be easy. Now if your patient is aggravated, what you will do from the first dose? First, ask your patient how much he is taking, and he will tell, in the most cases, that he will tell that whole glass I am taking. Okay, so ask your patient first to stop this for 2 days. Okay, next to take only 1 teaspoonful of medicine from that cup. Okay, that will do. Okay, if even only one chamuch is being taken, patient will tell that babu ami ek chamuch hi khacchi. Okay, then what you will do? Stop the medicine for 2-3 days and try to switch in centesimal. If you cannot switch in centesimal, then take it in olfaction. Take it in olfaction. That will not bring that bad name. That is a second cup will bring. Okay, second or third cup will bring, and patient will not understand the things. Once you are senior in your profession, you can ask your patient to take second or fourth cup. I am asking my patient to take in second or fourth cup, but with fear, with only with my older patients, not with newer ones. Okay, with fear I am asking my patient to take. So give it in olfaction. And olfaction, what is the method of preparation of olfaction? How to prepare the olfaction dose? Same. This is 1 gram glass vial. 1 gram glass vial. Take this much distilled water, dissolved single globule of LM potency. Put rectified spirit up to this. This much is rectified spirit. Okay, and ask your patient to give the bottle every time 10 succussion, and then inhale fully in both the nostrils. Okay, that will be the olfaction method. Clear? Now from which we now come back to aphorism. For this purpose, we potendize anew the medicinal solution with perhaps 8, 10, and 12 succussions, from which we give the patient one, increasingly several teaspoonful doses in long-lasting diseases daily. Underline this. Or every second day. In long-lasting disease, daily or every second day. This both we have seen in NIH under our different teachers. Some are given daily, some are giving every alternate day. Okay, in acute diseases every 2 to 6 hours, and very urgent cases every hour or oftener. Thus in chronic diseases, every correctly chosen homeopathic medicine, even those whose actions is of long duration, may be repeated daily for months with ever increasing success. Underline this. Those who claim the footnote forget the aphorisms. Okay, those who claims for the sake of claiming, they don't see a single patient using LM potency, and for the sake of claiming, they are for the sake of exalting their own skills of knowing Organon too much, they will misguide you to use LM potency in single dose. Okay, using LM potency in single dose is an exception, not the rule. Always remember, they are proclaiming the word necessary from the footnote, forgetting the aphorisms and the clear-cut direction of Hahnemann to give it daily, repeat it oftener with increasing success. Okay, थोड़ा knowledge हो तो उसके साथ wisdom भी होना जरूरी है. Okay, only knowledge, full stop, comma, everything has been remembered, and no wisdom to use that. Okay, a plain simple wisdom will tell you from all the practical experiences that LM potency acts better in repetition. Okay, so always seek knowledge with the wisdom. Okay, seek knowledge. Oh God, give me knowledge with the wisdom to use that. Okay, and forsake from the knowledge which is devoid of wisdom. Okay, that is information paralysis. There is a terminology for that. So This underline this. Now, if the solution is used up in 7 to 15 days, okay, we usually we have standardized it to 16 days. It is necessary to add to the next solution of the same medicine if still indicated one, although rarely several pallets of higher potency, with which we continue so long as the patient experiences continued improvement without encountering one or other complaint that he never had before in his life. Now you can again give 0 by 1, but here we have standardized it to after 0 by 1 we are giving 0 by 2, after 0 by 2 we are giving 0 by 3. Okay. Now for if this happen, if the balance of disease appears in group of altered symptoms, then another one more homeopathically related medicine must be chosen in place of the last administered. Group of symptom, underline this, group of altered symptoms. Administered in the same repeated dose. Mindful, however, of modifying the solution of every dose with thorough, vigorous succussion, thus changing the degree of potency and increasing it somewhat. On the other hand, should there appear during almost daily repetition of the well-indicated homeopathic remedy towards the end of the treatment of chronic disease, so-called homeopathic aggravation by which the balance of morbid symptoms seem to again increase. Underline this, underline homeopathic aggravation. The medicinal disease similar to original now alone persistently manifests itself. The doses in that case must then be reduced. Underline this. Doses must then be reduced still further and repeated in longer interval and possibly stopped several days in order to see if the stopped several days. Underline this, what I have told. Ask your patient to stop it. In order to see if the convalescence need no further medicinal aid. The apparent symptom, this is sin symptom, underline this, sin symptom, caused by the excess of homeopathic medicine will soon disappear and leave the undisturbed health in its wake. If only a small vial, say a dram of diluted alcohol used in treatment in which the content dissolved thorough succussion 1 globule of medicine which is to be used by olfaction, underline this, every 2, 3 or 4 days, this also must be thoroughly succussed 8 to 10 times before each olfaction. Underline this. Okay. Now this is sin symptom. In LM potency you will see the aggravation. I have seen so many sin symptoms in my patient. After 0 by 10, 0 by 11, the original symptoms were returning. I stopped the medicine. First I stopped the medicine. Then again with the symptoms coming, then start the medicine with the reduced dose. That is increasing the cup. Increasing the cup is reducing the dose. Okay. Now go to 280. Aphorism number 280. Aphorism number 280, 6th edition. 6th edition. The dose of medicine that continue serviceable without producing new trouble symptom is to be continued while gradually ascending so long as a patient with general improvement begins to feel in a mild degree the return of one or several old original complaint. Underline this. Now see, there are 3. This indicates first sentence, this indicates second sentence, this indicates third sentence. All these have been a question in UPSC examination that the original complaint is returning. This indicate what? Okay, these were all in the option and the final option was all of these. People were being confused and marking 1 or 2 and not all of these. Okay, so we will read again. We will read again 280. The dose of medicine that continues serviceable without producing new troublesome symptom is to be continued while gradually ascending so long as a patient with general improvement begins to feel in a mild degree the return of one or several old original complaints. This indicates, underline this, an approaching cure through gradually ascending of the moderate dose modified each time by succussion. that modified each time by succussion have been given in 247 6th edition. Okay, remember that is aphorism often asked in your MCQ examination. That 247 of 6th edition is important in the sense of modifying the preceding and following doses. It indicates, number one indicates that the approaching cure. It indicates that vital force no longer need to be affected by similar medicinal disease in order to lose the sensation of natural disease. Okay, 148. It indicates that the life principle, now free from natural disease, begins to suffer only something of the medicinal disease hitherto known as homeopathic aggravation. Okay, that is homeopathic aggravation in LM potency, seen symptom coming at last. Okay, seen symptom has been discussed in 248. Okay, and to some extent without the terminology in 280. Okay, so write in the margin here in 248 280. 280. The last part of 280 is regarding olfaction of the LM potency that has been discussed. In this class only we have discussed how to prepare the vial for olfaction. Okay, just refer to that. Now 249. 249. That 6th edition 5th edition Jamila has been cleared here. With the LM potency we have discussed to somewhat all the practical clinical purpose. Now 249. Every medicine prescribed for a case of disease which in the course of action produces new troublesome symptoms not appertaining to the disease to be cured is not capable of effecting real improvement. Underline this. New troublesome symptom, disease to be cured, not capable of effecting real improvement. Underline this. Go to footnote. Last. Footnote 249. Footnote 249. As all experience shows that the dose of especially homeopathic medicine can scarcely be prepared too small to effect perceptible amelioration in the disease for which it is appropriate, we should act injudiciously and heartfully. Were we when no improvement or some, though it even slight aggravation ensues, to repeat even increasing the dose of the same medicine as is done in the old system under delusion that it was not efficacious on account of a small quantity. Every aggravation, underline this. Okay, you find some new symptoms. Okay, the new symptoms has been, I have discussed before also, the new symptoms you have to justify from where these new symptoms are coming. Okay, there are 3 cases where the new symptoms may be coming. Okay, 3 cases, new symptoms, 3 cases. Okay, this new symptoms may be coming as an old symptom, return of old symptom, and patient have forgot. Okay, this is a good sign. Number 2, new symptoms coming from arena of medicine. Okay, and new symptom coming from arena of disease. Okay, what do you mean by arena of disease? Medicine. That you have given a medicine, old symptom clear, old symptom was, and patient have forgot, and for him it was new symptoms. Now medicine, arena of medicine, you have given brainia for a patient for constipation, and patient is complaining of headache, and you opened up your brainia and found that headache is there. So headache is there, and this may be the case that constipation is also there, headache is also there. The medicine was not chosen correctly, but constipation has been relieved and headache is there. The patient was maybe oversensitive to brainia and started proving, or the patient that medicine was wrong. Okay, constipation has gone and headache is there. The patient was if the headache is there and headache is there as a new symptom, and constipation is also there, medicine was chosen wrongly. Okay, and maybe patient was oversensitive to brainia and started proving, or maybe the dose of medicine was excessive. Once you stop the brainia, and the troublesome symptom will go. Okay, so arena of medicine. From the arena of disease, that you have given medicine for cough and patient have started to with breathlessness, with hemoptysis, that rog roger mote jacche, rogi rogir mote jacche. That means that rog is disease is progressing. You have given a medicine for prostate cancer. This example I usually give of prostate cancer, and patient is complaining of backache. We all know that prostate is metastasis of the prostate cancer is to the vertebra. That means the what does this mean? That disease is progressive. Your medicine is not acting. Disease is progressive. Your medicine is not acting. New symptoms indicates that medicine is not acting. Okay. Or if it is from the arena of medicine, medicine may be excessive dose, or medicine was not acting, or patient was oversensitive. Even aggravation by the production of new symptoms, when the new symptoms onto what has occurred in mental or physical regime invariably proves unsuitableness of the part of medicine formally given in the case of disease before us, but never indicate that the dose has been too weak. Okay, don't think that the dose have been too weak and you have to give. New symptoms are coming. New symptoms are coming. You have to repeat the dose. That is not the case, and cannot be. Now come to aphorism. And cannot be considered homeopathically selected. It must therefore either, if the aggravation be considerable, be first partially neutralized as soon as possible by an antidote. Underline this before giving the rest remedy. Choose in more activity according to similarity of action. Or the troublesome symptom be not very violent, the next remedy must be given immediately in order to take the place of the improperly selected one. Okay. So the next remedy will antidote itself. No need to give extra antidote. You will see the 6th edition footnote here. There, the well-informed and conscientiously careful physician will never be in position to require an antidote in his practice if he will begin as he should to give the selected medicine the smallest possible dose, alike minute dose of a better chosen remedy will reestablish order throughout. That is, antidote is not needed. Give your best selected remedy, next selected remedy, and it will take care of that. Okay. Now 250. When to the observant practitioner who accurately investigate the state of disease, it is evident in urgent cases after lapse of only 6, 8 or 12 hours that he has made a bad selection in medicine. Laugh given in that patient state is growing perceptibly, however slightly worse from R to R by the occurrence of new symptoms and suffering. Okay, from the arena of disease. It is not only allowable for him, but this is duty to remedy his mistake by selection of administration of homeopathic medicine, not merely tolerably suitable, but almost appropriate possible for the existing state of disease. Okay, for the existing state of disease. This is 250, and 251 is regarding the alternating action. Alternating action, we have read it before also. There are some medicine like ignitia, brainia, rustox, and belladonna, sometime, whose power of altering man's health consists chiefly in alternating action. What is alternating action has been discussed in aphorism number, I think, 115. Okay, aphorism number 115, it has been discussed. Just follow that aphorism and you will get 251. From 252 onwards, no need to read it. What you have to do in cases of alternating action, you have to repeat the same dose of same medicine. Okay, repeat the same dose of same medicine in alternating action. In cases of alternating action, I have told you that I am using ignitia in centesimal potency. If I am using, I will use a paired dose, paired doses, in paired doses. 2 dose, 4 dose, okay, never in odd dose. So that is the case. Now 252 onwards is signs of improvement. We will read in the next class. From 252 to 256 is the signs of improvement. In the next class we will read. Okay, thank you for giving your attention for 1 hour. We will meet next and try and complete the signs of improvement in from Stuart Close, from Kent, from Roberts, and from Organon of Medicine itself. Thank you.